Hey everyone, Gamma here. Hope you've all had a good week so far. I'm back here with, I think we're up to 7 so far. This is probably the most consistent I've been with any sort of content creation so far, at its usual time, very late on Sunday. I've had a very busy weekend, I'm not going to lie to you. You should be able to see just about, probably can't see the whole thing because of the way my GoPro films, but my office is a lot tidier. I think based on the post you probably saw about me, I'm not sticking to a streaming schedule for now. I've sort of taken a step back and I'm trying to just get my house in order and make sure I've got the basics covered before I put too much of my time and effort into things that are extra. The videos I feel like are really manageable, and I didn't want to give those up, but I think it's sort of one of those things where you start small, you build up, rather than putting all that time into something when I was sort of maybe foregoing some of the other things I had to get organised. So that's what I've been up to. I had church this morning, and then it's just been housework really, hoovering, dusting, that sort of thing. Me and Shannon just getting the flat into prime condition, which feels pretty great. I just realised from the preview on my camera when I was setting up, I'm pretty sure I wear this hat quite a lot, and whenever I look back at my footage afterwards when I'm editing it, all I can see is Prism Mic from The Office, the US one. I saw the UK one years ago, and I think it's great, I think it's funny, but I can't bring myself to agree when people say it's better than the US. I know typically I tend to be more inclined towards British humour than I would be American humour. I love the UK In-Betweeners, can't stand the American remake. But yeah, I just love the American Office. I'm already 2 minutes in and this has all been waffle so far. We don't even know why we're here yet. So I've spoken about sort of how chemo works, and how your stain might work. I've spoken about the side effects themselves, and I think it's probably just to do a video dedicated on what the sort of 2 weeks after you have chemo, well, sorry, I say 2 weeks, 2 weeks for me, the intermediary period between your chemo cycles. It's sort of based on the list I've got here. It's just sort of a list of advice and just sort of things that you can do to look after yourself. I know it's not groundbreaking or dramatic or anything like that, but there'll probably be some crossover between videos I've made before, but it just made sense to do a list of things for that you should do in that period of time. Just to look after yourself and just keep yourself managed, and that'll feed into keeping your side effects at bay, keeping you in the best condition you can in between chemos. I don't want to talk about it too much right now, but I'm in the early process of making a video that's probably more of an opinion-based piece. I've been seeing a lot on social media at the minute about sort of very anti-chemotherapy, anti-radiotherapy sort of sentiments online. And I really wanted to have a conversation about that because I've got a lot of thoughts and opinions on it, that I haven't articulated my thoughts on paper, so I'm not going to articulate them now, but that is the plan for what the next video will be. So we may not be a Chronicle next week, that'll probably be more of I don't want to say a rant, because I'm not going to rant at the camera. I probably will rant at the camera a little bit, I probably just will, but yeah, so that's fine. So this is basically managing the days after chemotherapy in the run to the next one, and I'm not just going to read it. I'm going to sort of go through each point and just sort of give a couple of minutes talking about it, and then this is sort of a repository of what I would recommend. So it might not be in the most logical order either, because I'm scatterbrained like that. So first thing I want to talk about is sleep. So even now, about just over a year after treatment, I need to sleep a lot. So I work part-time at the minute. I work 3 days a week, and on Tuesday and Thursday, between those days at work, other than doing a little bit of housework, I'm mostly asleep throughout that whole day. And I will tell you, my body needs it. Aside from I'm a bit of an insomniac anyway because of my anxiety, but even if that wasn't an issue, even quite far after finishing treatment, your body's still recovering. Your stamina and energy levels take time to recover. So if I need to sleep all the time after treatment, your body's going to be firing signals all the time that you need to sleep. And it might seem a little bit strange at first that you'll be tired quite consistently, and you might start to worry if it's something you're doing wrong. like you might worry that you might grow lethargic, or you think like, is it because I'm not getting out enough? While those things can help making sure you maintain good sleep hygiene and getting out to exercise, which is another point, you're going to be tired most of the time. And the important thing to do is not to push it too far. I think keeping yourself on track and looking after yourself is important, but you're probably going to need to sleep a lot, and that's fine. Try not to worry about it. Like, you're not missing out on anything. You're not I think what I'm trying to say is, like, don't fight it too much. Like, it's nice to get out and do stuff, but you need to you're having many harmful chemicals pumped into your body to treat your illness, and you're not going to walk away from that feeling great. And part of that healing process is to sleep, so try and make sure you're doing that when you can. In terms of sleep hygiene, I would say that if you are awake, to get out of bed, don't spend all day lingering in bed. If you can, try and at least transition to a chair, go and sit on the sofa, go and sit outside, get like some vitamin D, because that's something that like you'll lack from staying indoors for too long. Or if you're laying in bed, that's one thing, but like, try not to like scroll on your phone while you're in bed, like to watch TV or play video games from your bed. I'm guilty of it. I do it. You're not a terrible person if you do it once or twice, but try not to do it consistently, because your brain can build, like I've spoken about with food before, you can build associations with locations, and if you should try and aim for your bed to only be associated with sleep, and that will do you a benefit in the long run, so that you're resting at appropriate times, and that's pretty much it. Medication, I would say also try and get into a good routine with taking it. Make sure you take it at consistent times each day based on the advice you've been given. And I would also say to organise your medication into a dosset box. Dosset boxes, I have one here. It just tells you, should be able to see it. I can't see what you're seeing, so I'm just going to wave it around on the screen slightly and then put it there. Dosset boxes, so mine's marked every day of the week, so what pills I have to take each day. That's because I just take mine all in one go, because it's a little bit simpler now that I'm out of treatment. You can get ones like the ones I had organised before, they break it down like even further. So I think mine had it must have had 5 different time periods for the day, just to keep yourself organised and because you'll be taking a lot of pills. So getting into a consistent routine with taking it will help them be more effective, and it will help you keep track of them a little bit easier as well. I know that I was very lucky. My parents would organise my pills for me, which was good for me because I'm quite scatterbrained anyway, and with my neuropathy, blister packs would have been a bit of a pain. But it just helps you stay organised. So if you are doing them yourselves, you'll probably get given one. I don't know if they hand them out, but they're very easy to get hold of, so I would definitely recommend using one. Fluids, I said this before, you need to drink an almost illogical amount, to the point where yes, you'll probably be going to the toilet all the time, but as I'll discuss later, that's also a good thing. Drinking a lot of fluids helps your body process chemotherapy and get it out of your system faster. So once it's actually treated the problem area, so like with my rib, once it had actually done what it needed to do there, you're flushing it out. You get it out of your system. You don't want it to linger for too long, because that'll do lingering damage to parts of your body that don't need to be treated by chemotherapy. So drinking a lot helps that go a little bit faster. Food's a slightly more difficult topic. I would say in the immediate aftermath of doing your chemo, maybe for a day or so, I would say to be cautious, at least maybe 2. Don't eat your favourite foods, because you can build negative associations. So I would say, considering conversations I've had recently, rather than just when you've just had chemo, try not to have them around the times you feel worse. So, for instance, some people tend to feel worse a week or two after they've had chemo. Some people feel terrible immediately afterwards. I would just say be cautious about when you're eating your favourite foods so you don't build up those negative associations. I'm not going to say it because it's going to make me feel ill, but I sort of have in the back of my head a food that I used to enjoy that I can't even discuss now because I had it when I had chemo and negative association. I can't stand it now. So take it from me, please be careful with that. Also as well, I know treatment can last for a long time for many people, so I did 9 months worth of chemo, but some people, like the leukemia patients, do it for years, and it can be difficult staying away from your favourite foods, but I would say you're probably better off sticking to softer and plainer foods, especially if you're prone to damage around like the throat tissues, like I've had problems with mucositis, at least around the times where you feel worse, where your symptoms tend to peak. Just because you're doing less damage to those tissues, and it's just you're preventing another level of discomfort that you would have to deal from. I've discussed it before, so I won't go into it too much, but cold foods like ice cream, enjoying them frequently is also good at helping keep chemo away from these sorts of tissues as well, and it can make you feel a little bit a little less uncomfortable. It's called cryotherapy. I don't know if it's a proven thing, but I definitely experienced some benefit. It's not a treatment, it's not a cure, but it will just help soothe some of those tissues and help them from getting as sore during your treatment. So, and at the end of the day, it's just a bowl of ice cream, a nice lolly, putting maybe resting an ice pack on your throat. It's it's not complex, not taxing. There's no risk really, except maybe putting on a teeny bit of weight. But if you're doing treatment, that's perfectly fine. I put on plenty of weight. That was the least of my worries. It shouldn't even be anywhere on your list of problems. Who cares? Just eat what you want. What else as well? I'm not going to say counter to the sleep point because it plays into it. So that you don't get lethargic. Try to leave the house for a walk at least once a day. Even if that's just you're just pacing around your garden for a little while, you're just experiencing some fresh air, getting some sunlight. It's useful. It stops you getting cabin fever, getting headaches. It helps you feel energized. So it sort of helps alleviate some of that tiredness that you're going to be feeling all of the time. But it also helps you keep an eye on your oxygen levels as well. So at points during my treatment, I suffered from relatively bad anemia. I needed blood transfusions. That's another thing I'm meant to be making a video on at some point. I've just thrown myself completely off where I was talking then. Your oxygen levels. If you find that you're getting tired a lot quicker and you can't cover as much of a distance, that could mean that you're becoming anemic. And then you then to go and speak to somebody. Like if it's quite pervasive, you might need to talk to somebody before you go for your next regular treatment. That's cool. They can help you out there. But you're taking an active stance or an active role in looking after yourself and maintaining yourself and just sort of preventing you from getting to a worse point. Because if you stay in bed for 2 weeks going for treatment and then all of a sudden you collapse and they're anemic. If you're getting out for your walks, you can catch that a little bit earlier and get some, get a bit of a top up, get some extra blood before it gets too bad. Walks are just nice. It's just a nice change of scenery, really. Feeding into that, I would say, obviously it's a very appropriate topic to talk about in a minute, but ignoring COVID, I would say to maintain a healthy distance from strangers. And what I mean by that is, I'm not saying I'm going to sort of phrase this as though we're not in a pandemic, and I'm sort of talking more as though you could see family and loved ones, and that's fine because you can communicate with them more easily about who's ill, who you should and shouldn't have round in that context. But and having a chat with a stranger isn't, I'm not saying don't talk to people or completely avoid people, but I would just say that the immunocompromised, my screen just went off. The immunocompromised, which very likely means you have weaker immune systems, you're more susceptible to contracting an illness. And strangers don't know that, so it's, I did that. You've got to just sort of keep a healthier distance away from people, or at least establish that that they're not going to pass anything on to you. It just keeps you safe, and that was something I put up with before doing treatment, and that's something I'm putting up with right now. It's just in a different context. It's very similar. I would say as well, maintaining good oral hygiene is very important. Making sure that you brush your teeth, use mouthwashes. If you experience problems with your throat, like I did, you'll probably be prescribed several. You'll probably get a lot of ulcers as well. And I know it's probably the last thing you want to do is go near your mouth when there are any ulcers, but brushing your teeth regularly and clean, like getting rid of dead skin cells and bacteria that build up and are sort of one of the root causes of your ulcers. That's all good for managing them. I don't know if it can get rid of them, but I think it can probably not make them quite as bad. So it's uncomfortable, but it's worth it. And then, like, composite to that, staying clean as much as you can. If you've got a port or a PICC line in, that can be uncomfortable and slightly difficult to maneuver, but having showers and baths where you can, it reduces the risk of infection for your lines. Also makes you feel good as well. Like, I don't know anybody who doesn't like a warm shower. It's rejuvenating. It relieves tiredness as well, which can only help in your situation. I would say as well, so for me, I have my neuropathy. I also had it in my feet as well. Not in my feet anymore, luckily, but maybe getting somebody to check the water temperature for you just before you get in it. It takes like 5 seconds and it just stops you from getting burned. So make sure that you're doing that. I'm just going through sort of the more, I guess, medical ones, and then I'll get like into a couple of points I have about like recreational stuff. Going to the toilet regularly is good. Don't hold it. Don't worry about what XYZ. Obviously that's slightly different if you have cancers that affect like those particular areas. I can't offer advice on that area, but all I'll say is drinking plenty is good because it gets you going to the toilet frequently. And it gives you more opportunities to be observant, so look out for any blood, any sort of discoloration, anything like that, because that's going to be how you might detect possible infections, which can be blockers to your treatment. Like I had a water infection once when I was doing chemo. Luckily it didn't delay my treatment, but it was uncomfortable and I had to take extra medication for it. So trying to catch it maybe between treatment will make your actual time spent doing chemo slightly less unpleasant. If you have a PICC line, make sure you've got things set up like with your a local care facility or like nurses that come in to get your PICC line changed. It sucks, it's uncomfortable, it can hurt. I hated it. It got in the way of me having a shower or a bath. It sucked, but get your PICC line changed. I think it's at least once every 2 weeks because you're stopping infections, you're not delaying chemo, you're getting through the process as easy as you can. PICC lines are a good tool as well because it means you don't have to be cannulated, so you don't have to have needles put in when you're having things done like being given chemo or blood or fluids. You just have it through the convenient like cybernetic tool that's hanging out of your arm instead. But if it's there and it's getting in your way in other places, you might as well make sure it's doing its job. I would also say as well, these are probably just the last couple of bits, conscious of time as well. Find a hobby. So for me, those were primarily writing and video games. But I would say make sure you're doing ones that stimulate and train the mind to help things like chemo brain and other forms of cognitive impairment. So reading, writing, video games, puzzles, that sort of thing. And maybe ones that might train a little bit of dexterity in your hands as well, because the muscles in my hands started to atrophy after a while. So like using stress tools, maybe doing some drawing, painting, that sort of thing. It lets you keep an eye on those symptoms as well as, you get to create something as well, which is pretty awesome. The last point as well, I'd say, is take time to check in with your friends and family as well. So chat about how they're doing as well, because I feel like something I observed is people didn't want to sort of bother me with what was going on with them when I was doing treatment, or sometimes there are periods where the only thing you were talking about is symptoms of not feeling well. So just ask how people are doing, and then spend some quality time with them. Watch a movie, just chat about anything. It doesn't have to be about treatment or illness. You just have a conversation and try and distract yourself from what's going on for a little while. That can only be good. And I thought I had more to that point, but just make sure you're like is a good way of helping things like getting out of bed and that sort of thing, is going spend some quality time, invite somebody out on your walk, that sort of thing. It helps you stay connected, and you know they can help you with like some of these self-management points I've given today. And at the 20-minute mark, I'm going to call it a day. I hope this is useful and not too waffly. I was expecting this video to be like twice as long, but I think you could probably tell that I'm trying to get through it without like making it way longer than it needs to be. So hopefully that's useful. Feel free to comment or send me a message on the Gammastories page if there's anything that you want to talk more about. A sub and a like is always useful in terms of the algorithm. We had that one random video that somehow ended up being seen by over 1,000 people. So if we can trigger that again, that would be awesome. So we'll consider it like a late birthday present or that sort of thing. So rant video later in the week, I assume it will probably end up coming out like that. I need to do some research and that sort of thing. So I look forward to that. I look forward to seeing you all again, and I hope you have a lovely week. So take care, everyone.